If you've got a back, it's likely that you've experienced pain in the area, in your lower back, your middle back, your neck. Having the spine is a complex thing. I've had my share of back pain. I know Marcus has had his as well. And we would like to put a stop to it. It can be prevented, and also when you're experiencing it, we can get out of it more gracefully so it doesn't keep recurring and coming back. So if you've been experiencing back pain maybe at the moment, or if it's happened in the past and it's like in the back of your mind, I have to baby my back because I'm worried about hurting it again, then this video will be useful for you. So we're going to go through 4 key things, and there's likely more that we could cover, but these are really 4 primary things that I would recommend if you're looking to not only get relief for current back pain and also prevent future back pain as well, or at least mitigate the likelihood of it coming back as best as possible. So let's dive on in. And as we do, I just would like to say one of the first things that likely comes up when we're in pain around the back is it may be associated with tightness, and then we may think that we need to stretch to alleviate that tightness. First thing I would recommend is it's not the most useful first step when working with pain. Even though it might feel like, oh, I'm getting pain, it's because I'm tight, I need to stretch, and it might trigger that response. Often this area is saying, hey, I'm not stable. And by stretching it, we can often push it further out of that stability zone. So there's just a first key point as we go into this to debunk a common belief of, I have pain, I need to stretch. Of course, do whatever you want to do. However, after a long time of observing the nature of back pain and the success rate of it relieving with hundreds of students, I would just recommend that. So we'll go into some more recommendations as we go. Do you want to add some things as we go into talking about how to stop back pain, Marcus?
Yeah, it's just a common thing, like you said in the intro. Back pain is a card which many people are choosing in today's society, and in a way, it's pretty simple to understand when you know where to look. But the main thing where people get stuck is trying to fix their back, but often the back is just the symptoms of other things, and
Mm.
this is what we start to discover today.
And on those symptoms, one of the core symptoms are generally a lack of movement in any area of the spine or the areas that connect to it, and a lack of connection or awareness. So just think about that as we're going into it. If you're experiencing back pain, or if you have been, are there any areas where you feel disconnected from with your body or with yourself? Or are there any areas that you have difficulty moving that you're aware of? If there are those areas straight away, you can safely have some comprehension that there is a risk factor for pain somewhere in the body to build up. This is not to create fear, but to create inspiration of like, oh, there's areas in my body which I don't have a full connection with for whatever reason. I might have injured it in the past. I might just might feel uncomfortable in that area, and I avoid connecting with it. This is an invitation into connecting with those areas that might be dark within your body, to shine light into those areas, understand them, give them what they need, so then your body can be more integrated and whole. And in that space, it's far less likely that pain builds up. So we'll go into the 4 key things. If you do these 4 things, or if you're aware of them, it's going to be you're going to be much more successful in getting lasting relief of back pain. The first thing that we'll talk about is diaphragm mobility. Now, we've talked about breathing and the diaphragm in future videos, or in previous videos, which you can check out, but we'll talk about it in the context of back pain. I'll let you start off, Marcus, and we'll have a chat around that.
Yeah, and just get the diaphragm moving from a pure physical perspective is very useful, because when we look at the anatomy, the diaphragm is connected to the whole spine through fascia lines. So you will see a connection from the bottom of your hips up into your head. And every time you breathe, the diaphragm will all this tissue get moving. And if we have back pain, and if you have back pain, then there will be a chance that this whole tissue is not able to move in a fluent way. So just to start connect with the diaphragm, get a feeling for this muscle to move more freely can be a very useful way to do and to start. And I often start with simple things like, are you able to feel that this air is moving when you're breathing? And just connect with the body and then go from there. And for diaphragm mobility, you can share some insights how to do it more specifically.
Well, for specifics, we cover heaps of practices inside Movement Plus as well, but we'll talk more about it in the context of first just think about if, let's say, you just like breathed all your air out of your body and then move your spine around in that situation. If you think about your breath as it's like it's a pressure creator, an airbag within the system. Now imagine that you didn't have any pressure stabilizing that system, that it was just deflated, like a deflated balloon. And then you go and move that, or imagine that the pressure system in the body was compromised. So then think about how that's going to affect the way that your spine moves if that whole system is not able to be able to move with the breathing, the thing that you're doing all the time, thousands of breaths a day, that accumulates. So often, we think about like, I need to do a stretch, and stretching can be great with a stable system when you understand your body and, how to move it with the right level of intensity for you and all of that sort of stuff. There's a real art to the practice of stretching. It does require some self awareness and understanding of your body to do it well, in my experiences. But by looking at the breathing first, particularly the diaphragm, we can start to get particularly like the middle and upper part of the spine moving much more. You might feel tight and restricted there in the beginning. It's really common because when we go through stuff, one of the first things that gets constricted is the breathing. So by starting to mobilize the diaphragm again, then the lungs can start to move more. As you're doing that, you might notice that maybe you're filling up more on one lung or the other. And then that's continually pulling you to one side and might be even twisting you around. You can't unstretch that pattern. If you keep doing that and then you stretch where you feel tight, but then you keep doing it, you can see the pattern that's likely going to happen. So if we come back to the thing that we're doing most often, the muscle that helps the spinal column move, then when you're sitting, when you're standing, when you're walking, when you're doing exercise, when you're doing anything, you're going to start to have more movement through the middle and upper part of your spinal column by getting the diaphragm moving. It'll also transfer to your lower spine, but we'll talk about that a little bit more with this next bit. So the next bit is lower body or lower abdomen mobility. Now, this is a common thing when we think about breathing. Often it's talked about like breathing to your abdomen, and that's kind of like a forward motion, which can cause compression on the lower spine. What we want to think about here is that we're filling down into the pelvis. And as we start to do this, you realize, oh my goodness, my abdomen can move so much more. My digestive organs can move so much more. I feel so much more stable around my lower back and how that works with my hips.
Yeah, and in a way, it's just coming back to what I shared in the intro. It's just like feeling the connection from the diaphragm directly down into the pelvis. So there is a direct tissue line connected through the whole spine down into the pelvis, and we just want to become aware of that again. So this tissue is able to move and not stuck in a habitual tension. And as soon this tissue starts to move, yeah, you can feel your hips will start freeing up, your organs will start doing a better job, and your lower back will naturally release a lot of chronic tension. And there is also often this habit in today's society, especially when we come from a fitness perspective, where everyone just draws in his abdomen to look more aesthetic. And this is a really not useful pattern to relieve back pain because it's just adding more to this chronic tension, and then the spine will get stuck even more.
Yeah, I did this. I did that for years before I even became aware of it. I was walking around like flexed, and I did so many core exercises. And what I developed was actually like a very rigid core rather than like a strong, supple core, essentially. When we refer to core, we're not just talking about your abdominal muscles, like we're really referring to the whole central axis of your body, everything that connects to your limbs. So, like the core of an apple, so to speak. So, the third thing to look at. So, we've looked at the mobility of your diaphragm. Get your diaphragm moving in all directions. That's going to be really helpful. Get your abdomen moving in all directions. Think of it as like strength training for your breathing. And then we look at the balance of the lower body. So, not just any one area, but looking at how your lower body is able to support your spine. If your hips are being pulled in one direction or tilted from another direction, or if there's ways in which you don't move or you have difficulty moving that are causing you to move into like habitual patterns, you lean onto one side, that all affects your spine. It's like the foundations of a house or a building or the roots of a tree. Everything that happens at those foundations affect everything that grows on top of it. So we don't want to just look directly at the spine. We also want to look at it in relation to what it's connected to, which is your lower body, which is connected to the ground as you move around.
Yeah, this is one key thing I often observe, that this is neglected. So if someone is in back pain and this person is trying to fix this back pain, they are not aware of the lower body. And if someone walks into my gym, or I meet this person online, I can see straight away, okay, this lower body is not moving very well. And just addressing those things and share awareness for that instantaneously will have a change on the back pain, because this person becomes aware of, oh, the body is connected from top to bottom.
Mm,
And if the baseline starts in the feet, ankle, knees, hips, if this is not working well, how will how will be there a chance that the spine can work well? There is no
yeah.
chance for that.
Yeah, I remember before I got into stillness practices like standing meditation, like horse stance, I'd done still a lot of lower body training for my sports, like squats, deadlifts, lunges, traditional kind of more gym based exercises, sprints, all of that sort of stuff. So I thought that I had already a strong lower body, but what I realized that I wasn't actually able to really relax weight into my lower body. And so it's kind of like an upside down pyramid where like my lower system was good at like tensing, but it wasn't very good at releasing. And so all that tension then kind of I wasn't super stable, and then I would often get like knee injuries, ankle injuries, all that stuff. Because imagine like that system is rigid. When it kind of hits things suddenly, it's more vulnerable to breakage. So as I started to practice is essentially where I'm moving more slowly, becoming more aware of the lower body. I'm there in positions for long enough that I can become aware of my own patterns of how I'm carrying myself. Then all of a sudden, my lower body started to shake and all this sort of stuff as the deeper tissue was starting to strengthen and stabilize a lot more. So my surface muscles were strong, but my deep postural muscles around my hips and ankles and knees and feet, they were not very developed. So it's another way of starting to look at how we can develop the lower body to be a stable structure to support everything on top. So it's not just maximal strength, it's also developing these postural muscles, which are deeper inside the body. So the last point is the organ health. Now, this is important because of how our mental faculties, how our emotions affect our whole system. For example, you can't outstretch or outmove an inflamed kidney, for example. And if a kidney is inflamed, that can then be giving you symptoms of back pain. So we need to look a little bit deeper when we're working with the more external systems, the muscles, the tendons, the ligaments, the fascia, all of that sort of stuff. That's great. But then we need to look at the central systems which process a lot of our inner world and our emotions and all of that sort of stuff. So we'll have a little bit of a chat around the different organs now.
Yeah, it's just reflecting often emotional habits, just coming back to the organ system, and it will also affect the fascial tissue. And yeah, this is what we talk about now.
Yeah, yeah. So the main thing just to be aware is that your whole body is a system. And when you experience a symptom, maybe you're experiencing it in the muscles, it may be indicating something deeper than that. And so when we work with things more holistically, we're looking at it as a whole system. So, say for example, we were talking about the kidneys before, according to Chinese medicine, and, I also do notice this. And the more aware you become of your body, the more you can then go, oh, okay, I have been holding a lot of emotion of anger, for example. You can feel where that starts to manifest in your body. It's not to say that anger is bad, for example. It's when it accumulates and builds up in the system, when it doesn't have an outlet to move. And if you've got past conditioning like I did, where I thought anger was bad, I would press anger down, and you can imagine that stuff builds up in the body. It affects then the function of the organ. The organ then becomes inflamed, and then that ripples out into the system. And then you feel you have back pain, and then you think, oh, I've just got a tight muscle, but we're not really getting to the cause of what's happening there. So kidneys can, really linked with a whole bunch of stuff. If you're like fatigued, then the kidneys decrease in their function. If you've been very stressed, your adrenal glands work with your kidneys. So all of that sort of stuff. So when you're low in energy, you might think, oh, I've got to, and then you feel back pain. I've got to do something. But first, you might need more rest. You might need more time in stillness, go out into nature, like have a look at the bigger context of what's happening in your life rather than trying to compartmentalize it. We could go through all the organ systems maybe in a future video, but I'll have a look at just like maybe the heart as well. So your heart, we're moving up to around the thoracic spine. And so we could look at this as, like the heart could be linked with certain emotions of like joy, if happiness is even an emotion, but like states of happiness. But then that can also lead to like over excitement of the system. So it's not to say that any one emotion is good. So it's like if I feel sad, then I should feel more joy, and that's better. It's essentially just like being in a state where the emotions are not overloading any one part of the system. So, like, too much joy can turn into kind of like an overexcitement, and then that then ripples through the system and then can affect the heart, can lead into heart palpitations and all of that sort of stuff, which can then kind of lead to feelings of like blockage and stuckness kind of around the chest and the center of the body in the upper region. So,
Yeah, this was just one thing I realized for me personally, that we are often just emotional junkies, jumping from one emotion to the other to get the next flash. And if you become aware of those conditionings, it becomes very easy to allow every emotion just to be there and to be felt. And there will be no need to produce other emotions to feel better, because you realized emotion is just one thing. It's coming and it's going, and that's it. And yeah, this is also a very beautiful skill for an overall balanced life.
so I would say, as we sort of wrap up on that thought, thinking of how organ health can affect also how your back feels and how there can be links with back pain in all different areas because your organs are around it. The main thing I would consider is, are there any emotions or like inner voices that are disowned? That can be a really good place to start. Are there parts of me that I suppress down? That's a really useful place to start, because if you do notice that, no, no, I can't let that voice be present or be seen or heard or felt, it can be indicative of where a blockage can happen, because that energy builds up in the system and it can only go so far until it can ripple out into other systems. So there's some food for thought, and hopefully a broader picture on some of the key things that we've noticed that can lead to back pain and what you can do to start to put a stop to it, and not just be always sort of chasing your tail and on the symptom train of trying to put out spot fires when you get back pain and then living in fear of, is it going to happen again? We want to build a robust, vital system that can continue to move well and have vitality with age. And to do that, we need to go deeper than just like exercise our muscles. That's great, but let's look at the body as the wonderful vehicle that it is, and how interconnected it is with our minds, and treat it as such. So I hope that's helpful. Of course, if you would like more support and more practices, guided practices, and ongoing advice for your unique body, because it's important that you do honor your unique body. There are general principles, and also everyone's individual. And so that's why we're here, to share our experiences and to make that process of feeling more vital and balanced in your body, to make that more graceful.
Yeah, thanks for listening.